Hi, my name is Corey Berlin. I'm the Director of Therapy here at Baylor Scott & White Orthopedic and Spine Hospital in Arlington.
And my name is Melissa Culver. I'm a pre-op and recovery nurse here at our hospital.
We're thrilled that you've chosen our hospital to have your surgery. And we prepared this video so that you can feel comfortable in your experience here with us and confident in going home after your stay. We will be discussing in this video joint replacements for knees, hips, and shoulders, and also spine surgery. It's very important that you view all of the segments as each one is vital to the success of your joint replacement or spine surgery.
The staff here at Baylor Scott & White Orthopedic and Spine Hospital are specifically trained in orthopedic and spine. This is all we do. What that means for you as the patient is you have nurses and medical staff that are experts in your particular surgery.
The importance of this class is to achieve a better outcome by better preparing you for surgery and recovery in the hospital and at home. The more information that you have prior to your surgery, the better chance you have for a successful outcome.
We're very proud of our facility and we hope you enjoy it. We're going to walk through it and give you a tour. As you're walking into our hospital, you'll see our welcoming lobby area and you'll notice we have docking stations throughout our hospital. So when you forget your charger, you can always charge your phone or your tablet. We also offer free Wi-Fi in the facility that is easy to access. We have an additional waiting room on our second floor. We highly encourage our family members to utilize either waiting area. On the first floor is our bistro. We have an award-winning chef on site ready to prepare wonderful and nutritious meals during your stay. Your family member that is with you on the day of surgery will receive updates of your surgery progress. Upon check-in, our registration staff can enter a cell phone number into our HIPAA-compliant paging system. Team members will send updates and notifications directly to that phone. Please be aware you may receive text updates from multiple numbers. Your family member may reply with any questions or concerns. Our patient advocate will also be available to help loved ones with any questions during your day of surgery. Our surgical staff will be interacting with the patient advocate, letting them know where you are in the surgery process. They will also update your family about your progress until a visitor is allowed in recovery.
This is the pre-op area. This is where we are going to get you ready for surgery, and it's also the area where you're going to meet your surgical team. Once your surgery is complete, you will be moved to the post-anesthesia recovery unit. This is where highly trained nurses will help you wake up from surgery. After you have met all your post-anesthesia recovery milestones, you will be moved up to the second floor on our post-surgical unit. You will be in a private room where your family members can visit, and this is where you will begin physical therapy. The average stay in our hospital is 1 to 2 days after your joint replacement or spine surgery.
This is our inpatient room. As you can see, it is large enough to accommodate a couple of visitors or allow for physical therapy in the room as needed. We have robes for you to utilize while you're here with us. We also have complimentary toiletry kits for you in case you forget something at home.
There is a communication board in your room to update you on the staff for each shift and your goals for the day. Everyone uses a walker while they're here with us. You do not need to bring your personal walker from home as every room has one. We do have walkers to issue to those that do not have one at the time of discharge.
We also have a private bathroom that is highly accessible for a walker or a wheelchair. Each room has a walk-in shower.
If your family members choose to stay with you, all rooms have a recliner chair for them to sleep in. But even though our goal is to make you as comfortable as possible, we still have work to do. Physical therapy occurs in your room as well as in the hallways and on the stairs as needed. That concludes our virtual tour of our hospital. Thank you for joining us, and we look forward to seeing you soon.
The purpose of this video is preparation. We want to make sure that you're prepared for your surgery. We'd like for you to make a list and organize yourself, to have a binder with pockets or a notebook, keep it with you at all times, include any questions you may have for your physician or your nurses, any appointments, medication lists, physician phone numbers, and discharge plans. We also have on-site case management that will assist with discharge planning. You may need home health care or outpatient physical therapy, or acute rehab or skilled nursing rehab. Case management can also help arrange for home medical equipment, but you'll learn more about that from physical therapy. One of the best ways to help prevent infection is hand hygiene. You should always observe your caregivers using an alcohol foam on their hands each time they enter and leave your room. This includes doctors, nurses, techs, dietary, and physical therapy. But please make sure to ask any of your visitors to foam in and foam out as well. Feel free to remind us if we forget. Hand washing is the best way to prevent an infection. We'd also like for you to have a coach. This is someone that's going to be with you at the facility. It doesn't have to be the same person for pre-op and for recovery, but your coach will be communicating with your caregivers, observing your physical therapy, and assisting with your transition to home and with home therapy. You're going to want to arrange for someone to be with you the first night after discharge, because even though you've been with us in the facility, home is a different environment. Before your procedure, you will be receiving a phone call from our pre-assessment department. They will want to go over your health history with you. You can also fill that out on our website. They will discuss your health history, set your pre-assessment appointment approximately 2 weeks out from your procedure. There you'll have your medical history obtained by our physician staff, obtain an EKG, labs, and if you're having any spine surgery, a chest x-ray. Please bring your full medication list with your dosages, your primary care doctor's number, and any specialist phone numbers that you see. Your surgeon may require clearance from any specialist prior to your procedure. You'll receive instructions for your day of surgery, when to stop eating or drinking, what medications to take, and your arrival time. You'll also receive an antibacterial shower kit. It'll be a shower gel, a poof, and instructions. You'll use this prior to your procedure. Also, please let us know if you have a history of MRSA. It's a special infection that we might need to treat prior to your procedure, and it can help decrease your chance of infection after. For your home planning checklist, we would like for you to prepare a recovery station on your ground floor if your primary bedroom is upstairs. We want you to walk through your home and remove any loose rugs or cords and clutter from the pathways. Pets must be controlled to prevent falls, so it's good to have someone with you whenever you plan to come home. You may want to prepare meals in advance and bring higher items to counter level. Measure your bed height if it's a high or a low bed, and that way our physical therapy team can help ensure that you can get in and out of your home bed safely. Chairs with armrests for sit-to-stand transfers may need to be brought into common areas to make standing easier. On the night that you start your antibacterial shower, we ask that you have clean bed sheets for your return home. Let's discuss packing for your hospital stay. As far as your clothing goes, you'll need loose-fitting pants and shorts, t-shirts, socks, and walking shoes with backs on them. As far as toiletries go, just bring the basics. You don't need to get all dolled up for us. And you also want to bring any additional items you may need, such as a cell phone with a charger, laptops and cords, tablets with your charger. We also have pretty decent Wi-Fi available here. On the day of your surgery, you'll receive instructions from your pre-assessment team on when to arrive, nothing to eat or drink after a certain time, only instructed medications with a sip of water, and please check your blood sugar, so when we check it here, we can tell if it's going up or down. You also want to refer to your packing list. Bring your prescription medication in the original bottles in with you that morning. Everything else can stay out in the car until you're assigned a room. Also, please bring your CPAP or BiPAP machine with your mask. You don't need to bring any water as we have that here. And then any personal items that you might need to make your room feel homier. Also, please have your family members bring a sweater or a jacket as hospitals do get very chilly. Please plan to arrive at our hospital on time. Sometimes traffic can be difficult, and just give us a call if you're going to be a few minutes late. When you check in at the front desk, please bring your photo ID and your insurance card. Please bring your medications inside before your procedure. Any personal belongings can be brought to your room after your surgery. Your family member will receive a text communication throughout the day. Let's discuss our preoperative routine. You're going to complete your pre-op forms, you'll have an IV started. We do use a nasal sanitizer called Nosin that helps decrease your chance of having a postoperative infection. And we'll be wiping your site with another antibacterial wash. Your surgeon, your anesthesiologist, and your OR nurse will come to the bedside in pre-op, and they'll all discuss your case with you and do a timeout. Each team member verifies the surgical site, and the surgeon will mark the correct site. We do ask that you speak up at this time if you have any last-minute questions. This might be a good task for your coach to be in charge of. We offer nerve blocks at our facility to help decrease your pain throughout your stay here with us. A nerve block is an injection of local anesthetic around the nerve that stops the signal to the brain. For example, we may do an adductor canal block that is close to the groin area that's going to provide pain control for those who are having a total knee replacement. Typically, the pain control lasts for 3 to 12 hours. We also offer spinal anesthesia for certain joint patients, and this is dependent upon your surgeon. It's an injection of medication into the spinal fluid around lumbar 3 to 4, and it's going to stop the spinal cord nerves from sending pain signals to the brain. You typically have a loss of sensation and weakness in the lower extremities with this procedure, but it resolves very quickly, and we can have you up with physical therapy in just a few short hours in your room. We also would like for you to know what to expect with recovery and visitation. The recovery nurse monitors vital signs, pain levels, and does her best to provide family members with frequent updates. We have one designated visitor in recovery that can come in and visit the family member. We do ask your visitors not to bring food or drink into the recovery area. Visitors in recovery is very case dependent, but depending upon the patient's pain level and sedation.
Now we're going to start talking about some of your therapy and rehab after your surgery. One of the things that we want to avoid in our hospital is something that we call a patient fall. This is something that can happen if you're not careful, and we want to talk about tips and ways to prevent this from happening. You want to always call the staff after surgery if you want to get up and move around to prevent yourself from being in danger. I want to go into a quick story about a patient that had surgery at our hospital. He had had a knee replacement, and when he came out of surgery, he was very anxious and ready to get up and start moving. We go into his room to evaluate him, and we noticed that his nerve block was still very strong. His leg was weak, he couldn't wiggle his toes or lift his leg. And so we told him that it's going to be very, very difficult for you to walk at this time. We helped him stand up and get into his chair with a 2-person assist. At that point, I gave him the nurse call button. The nurse call button controls the TV volume and channels in your room. It controls the lights above your bed. But most importantly, it has a button on there for you to call the nursing staff. So if you need pain medicine, if you need an extra pillow, if you need a glass of water, whatever it is, you hit this button and someone will bring it to you. It's almost like room service in the hospital. So I explained that to him, and I told him, I said, stay in your chair, do not get up until you call the staff and someone can come in to assist you. I subsequently went to see another patient down the hallway, and about an hour later, I got a call that we had a patient fall. This patient explained it to me as he didn't want to bother the staff, and so he tried to stand up and reach for his overnight bag that was a few feet away from him. He tried to put weight on the leg that was still numb from the nerve block, and he fell onto his knee directly and opened his knee back up. Absolutely the worst situation that can happen to you in the hospital. And the good thing for you all is that it's very avoidable, and you can learn from that story. We don't want you to put yourself in danger, so please call for assistance after surgery until we tell you that it's safe for you to get up on your own. Now I'm going to talk a little bit about ice therapy. Ice therapy is a very important part of your post-surgical recovery, especially for joint replacements. We're going to put ice on your knee, on your hip, on your shoulder after surgery to help decrease that inflammation. Even if you don't take a pain pill, ice can help decrease inflammation and take away some of your pain. It's a great way to help control your pain as well as the inflammation after your surgery. So once you're out of the recovery room, we're going to bring you upstairs to the post-surgical unit. You'll be transferred in your hospital bed, and you'll be assigned a nurse. Our nurses upstairs work 12-hour shifts. The day shift works from 7 a.m. to 7 p.m., and then the night shift comes on at 7 p.m. and works till 7 a.m. the next morning. You'll have an IV in one of your veins to help keep you hydrated after surgery. That also is for any kind of medication or antibiotics that your doctor may prescribe. A drain is something that's common after surgery. It's going to go right next to your incision, and it helps to decompress the area to help prevent something like a hematoma from occurring after surgery. This drain will come out before you leave the hospital. Sequential compressive devices are on your legs after surgery to help push blood back to your heart. It's like a little sleeve that blows up with air and helps to increase your circulation after surgery. Morning surgeries can expect to participate in physical therapy that afternoon. We're actually going to come in 2 to 3 hours after your surgery, help you get up to the bathroom, help you sit in your chair. It helps you to wake up from surgery and get some of that anesthesia to wear off of you. Early mobility is so important because your length of stay in the hospital has decreased. We want to get you up early, helps prevent blood clots, helps prevent pneumonia, helps to speed up your recovery. If your nerve block has not worn off after surgery until later in the day, your therapy will begin the next morning, and our nursing staff throughout the night can help you get up to the restroom or the chair. Visiting hours are unlimited here at our hospital. There are certain times of the night that the front doors are locked, and you would have to enter through the emergency room entrance in the back of the hospital. Our suites upstairs are designed just for our patients that are staying overnight with us here in the hospital. We have large spacious bathrooms with walk-in showers, all kinds of different chairs for you to sit in, and your family is welcome to spend the night with you if they want to. Now we're going to talk about a very important topic. It's talking about pain. A lot of times I have patients that come to me and say, well, how much is this surgery going to hurt? And I always tell them that pain is inevitable with any kind of surgery. But what you have dealt with before surgery is what we call osteoarthritis. This is the kind of pain that doesn't go away, it's constant, and it's with you all the time. It's because those bones, the cushion in between your bones, whether it's your knee, your hip, or your spine, that cushion has gone away and those bones are rubbing together. It's a very, very difficult pain to deal with. That's why your surgeon has come to you and said, we've tried all these other non-surgical options, now we need to go ahead and have the surgery. Now, when you wake up from surgery, you will have some pain, but it will be more of a soreness. It will be more of surgical pain that's from soft tissues around that joint or around that spine. This kind of pain is great because you know it's going to go away very quickly. Every week, I have at least 2 to 3 patients that come up to me and say, you were exactly right. It still hurts. I can still feel like my doctor did something, but this pain is nothing like it was before surgery. And that's a great thing to see when I talk to those patients. Muscle spasms is very normal after spine surgery. Because your doctor goes in and works on your spine, the muscles around your spine are designed to protect it. They're going to tighten up, they're going to spasm up and down your spine. Your doctor has given your nurses prescriptions to give you muscle relaxers as well as pain medicine to help you with this situation. Your therapy team will come in, like I said earlier, 2 to 3 hours after your surgery, and we're going to perform our physical therapy evaluation. We want to make sure that you're safe to get up and start moving around. We're going to develop our treatment plan based on what surgery you had done, and we're also going to set goals for you. And some of these goals will seem very simple at first. Getting in and out of the bed by yourself, transferring in and out of a chair or a shower by yourself. We're going to set these goals so that you can know how you're progressing and how quickly you are to being able to discharge home. Another great thing about our hospital is that your therapist, your nursing staff, they work very closely and communicate well with your physicians. We talk to your doctor on a daily basis about how you're doing and how you're progressing. Another thing that we're going to evaluate while you're in the hospital is your ambulation. We want to make sure that you can walk more than 150 feet using a walker. This is not a random number, it's what we consider a household distance. And honestly, a lot of our patients walk 300 to 400 feet easily before they leave to discharge home. We want you to be able to do 3 to 4 basic exercises by yourself before you leave the hospital. These exercises are designed to help you strengthen your legs and your muscles that you're going to use while you're recovering from your surgery. If you have stairs at home, let us know how many stairs you have. Let us know if there's a rail on one side or the other. We want you to be confident going up and down stairs before you discharge home. So what you're seeing now is just some patients that are working with some of our therapists. In one picture, you see them getting fitted for a walker, which you're going to take home for 2 to 3 weeks after surgery. There's also a patient doing bed mobility, learning how to keep their spine in a neutral position while they're getting out of the bed. Another one would be walking up and down stairs and making sure that they're confident performing that task prior to discharging home. A walker is a piece of equipment that you're going to use for 2 to 3 weeks when you discharge home from the hospital. We will make sure that that walker fits you perfectly and is adjusted to your height. You'll be using a walker because we want you to be able to walk confidently without limping or compensating on one side or the other. When you feel like you can walk without doing that, you can probably stop using the walker, and your therapist and doctor will help you decide when that time is right. Your walker is covered by insurance if you haven't received one within the last 5 years. If you have a walker at home, bring that to us and we will make sure that it's still in good condition and make sure that it's appropriate for you. Additional equipment can be appropriate that's not covered by insurance. There's things called shower transfer chairs, there's things called bedside commodes, there's things called toilet risers that could be appropriate for you if we think that's necessary. Don't go out and buy this now. We will evaluate you in the hospital to see if this is something that you will need after surgery. Occupational therapy is a service that we offer in our hospital that focuses on activities of daily living so that you can complete your routines of self-care and other activities as you continue in your post-surgical recovery. Your surgery may require changes to how you dress yourself, bathe, etc. You'll learn about equipment and strategies to accomplish your self-care tasks and how to modify your home environment to ensure your safety as you recover from your surgery. This is a picture of someone who had a shoulder replacement. They're wearing their sling and it's to be worn at all times for the first 3 weeks. It can be taken off for exercises prescribed by your therapist. Wrist and hand range of motion, elbow range of motion, and shoulder passive range of motion will be taught to you the day after your surgery. You can begin outpatient therapy approximately 3 weeks post-op as prescribed by your doctor. You're looking at different kinds of braces that would be on after a spine surgery. There's a cervical collar that goes around your neck to help prevent you from moving your neck in a painful way after a cervical spine surgery. There's also a lumbar brace. The lumbar brace goes around your abdomen and your lower back to provide comfort after your surgery. It doesn't have to be worn at all times, but mainly when you're up moving around a lot. Your therapist in the hospital will talk to you about these braces, how to put them on, how to take them off, and how long that you need to wear them. Now I'm going to talk to those of you that are having a hip replacement. First of all, we're going to talk about a posterior hip replacement. Your doctor will talk to you about which approach that he's doing prior to your surgery. With a posterior hip replacement, there are different posterior hip precautions. This is to help you not dislocate your hip after surgery. Because they go through the posterior capsule of your hip, the muscles that surround your hip in the backside are very weak and stretched out after surgery. This puts you at a higher chance of dislocating your hip. So we want to do 3 things to prevent that. First of all, we don't want you to cross your legs after surgery. We want you to use pillows in between your legs when you're sleeping to prevent yourself from crossing your legs. You can sleep on your side, just have a pillow in between your knees. The second thing is we don't want you to bend your hip past 90 degrees. Well, what is the 90-degree angle? If you think about a right angle from your shoulder to your hip to your knee, that's the angle we're talking about. You don't want to lean forward too far, and you don't want to bring your knees up too far. That will keep you safe from dislocating your hip. The third thing is not turning your feet inward. If you've heard the term pigeon-toed, where you turn your toes in, we want you to avoid that. Keep your toes straight forward or a little bit externally rotated after surgery. Next, we're going to talk about the anterior hip replacement approach. The 2 things that you want to avoid after surgery are extreme hip extension. That would be moving your leg backwards in an extreme position. The way to avoid this is if you're stepping backwards to get into the bed, into a chair, into the car, you would step back with the non-surgery leg first. So you're going to step with that leg and leave your surgery leg in a neutral position. The other thing is to avoid hip external rotation. A very comfortable position for us when we sit in chairs or lay in our bed is to lay back with our leg rotated out. You want to keep that knee and your toes back in that neutral position, even if you have to put a blanket or a pillow next to your leg. A common misconception after a total knee replacement is that you have to keep your knee bent all the time. This is a misconception because we want you to keep it straight all the time. The knee joint is very comfortable in a flexed or bent position. In fact, it wants to bend and flex after surgery. We want you to really work on keeping your knee straight and extended after surgery. There's an exercise that we're going to teach you and go over with you in the hospital, and it's called a quad set. In a quad set, you're going to tighten your thigh muscle and force your knee to go flat. This is an exercise that can be done repetitively. You can do it over and over and over. It's not going to make you sore, it's not going to make you tired, but it will train your knee to go into that full extension position. Very important to get that full extension 1 to 2 days after surgery to have a successful knee replacement. After spine surgery, you will have some precautions. One major precaution is not lifting anything more than 5 to 8 pounds. I think of that as like a gallon of milk. You don't want to do a lot of bending, twisting, or reaching overhead as well. Keep everything at waist level so that you don't put a lot of stress on your spine. We talked about the cervical collar and the lumbar brace. We're going to talk to you in the hospital about how much to wear these, how to take them on and off, and when you can stop using them altogether. The log roll technique is very important if you've had a back surgery. This is because after back surgery, it's difficult to get from a laying or supine position to a sitting position and then a standing position. We're going to really go over this technique with you right after surgery and teach you how to keep that spine in a neutral position as you roll onto your side and sit up out of the bed. Our length of stay here at our hospital is about 2 days. That's what we've averaged over the last several years. This means that if your surgery is on Monday, you can expect to go home on Tuesday afternoon or Wednesday morning. If your surgery is on Tuesday, you can expect to go home on Wednesday afternoon or Thursday morning, and so on. We do surgeries here every day of the week, so the weekend staff is just as ready to discharge you home as any other day. 2 important things have to happen prior to you discharging home from the hospital. Number 1 is pain control. Our main goal is to keep that pain under control while you're here in the hospital. Doesn't mean that you'll have 0 pain. It just means that on a scale of 1 to 10, we're looking at keeping that pain at a 5 or less. The number 2 thing that has to happen prior to you leaving the hospital is you have to be independent with physical therapy. That means that your therapist has come in and told you can start getting up and moving around on your own. You can do things unsupervised without the staff. The day that you go home, we like to call graduation day. Physical therapy will see you that morning. They'll go over any last-minute questions or activities that need to be accomplished to meet your goals prior to going home. You'll be getting discharge instructions from your nurse. They will go over in detail all of your instructions from your doctor, all of your medications, when to take each one, how much to take, all of these things that you may have questions about prior to leaving the hospital. All of your questions should be answered. The drain will come out. We talked about earlier, the drain that's next to your surgical incision. That will be removed. Your surgical dressing will be checked and in place, and you'll have instructions about that. Your home care plan will be in place. Our case manager will have already seen you and gone over that plan so that there's no confusion about what happens in the next couple of weeks. Our incentive spirometer will go home with you. That comes from our respiratory therapist right after your surgery, and it's a tool that you use to take deep breaths and really wake up your lungs after surgery. 10 times an hour or 10 breaths an hour is the protocol that we send you home with. After you go home, I want to give you some reminders, post-discharge, things that you need to really focus on. The exercises that you learn in the hospital are very, very important. Going through those 3 times a day as your therapist has prescribed. Setting a time for that ice, making sure that ice is on that surgical site constantly so that we can keep the pain down and keep the swelling down as well. Maintaining healthy eating habits. Your body is trying to heal in the couple of weeks after surgery, so putting good foods, fresh fruits and vegetables into your body will help with this process. Walking every hour is very, very important. You will learn in the hospital that it's not important how far you walk after surgery, it's important how frequent you walk. Getting up 5 to 10 minutes of every hour is very important to keep that joint mobile and to help with your pain control as well. Your first physician follow-up will be about 10 days to 2 weeks after your surgery if you had a joint replacement. If you had a spine surgery, it'll be at 1 week and then 3 weeks. They're going to take x-rays in the office. They're going to make sure that that joint replacement or that hardware that they put in your spine looks very stable and is healing properly. They're going to check your range of motion and strength if you had that hip or knee replacement and make sure that you're progressing and hitting those marks. They're also going to check your incision to make sure it's healing properly. They'll probably take the dressing off and maybe put a new one on or leave it open. Home health care will begin over these 2 weeks for a lot of you, and that's something that we'll talk to you more about in the hospital with therapy and with case management. Some of you will progress to outpatient therapy, especially knee replacements. They require a lot of outpatient therapy over the next several months so that you can see the progress and have the outcome that you really want. When can you start driving again? That's a question I get all the time, and it really depends on how much pain medication you're still taking, and it will be dependent on what your doctor thinks is safe for you and your family. Hydration is very important after surgery. It's important to increase your water intake as you're heading into surgery and after surgery as well. Our body's made up of 60% water, and so we're going to heal at a more optimal rate when we are fully hydrated. It helps to prevent constipation as well. Pain medicine will slow things down in your bowels, and we want to make sure that you're fully hydrated to help with this process. I would recommend, and our nurses recommend, that you take a stool softener, a generic stool softener, prior to surgery and then after surgery to help with this process. We've had patients in the past that didn't come back to the ER because of their surgical site, but because they were constipated, and we want you to be able to avoid that as well. Another thing to remember is that our hospital is a smoke-free facility. The less you're around cigarette smoke and nicotine, the faster you will heal. These things can severely delay your healing after surgery. In conclusion, thank you for watching this video. We know you'll be more prepared because of the information we have covered. And as a reminder, you can always go back and review any part of the video at any time.
We also highly encourage that you share this video with your family members or anyone caring for you during this process. Again, thank you for joining us, and we look forward to seeing you soon.